Ozempic babies. People are talking about them all over social media. And yeah, this is a thing. Allow me to explain why. I'm Dr. Lucky Seacon, a double board certified OBGYN and RAI. There are tons of comments like this everywhere from women who have a history of PCOS or who were told they had infertility and would never get pregnant. People who have been trying for 16 years who got on Ozempic, lost weight, and lo and behold, they were able to conceive. To me, there's nothing magical or shocking about this. It is no secret that weight gain or excess fat can interfere with the menstrual cycle and ovulation and make it harder to get pregnant. We know that there is excess estrogen production when you have more peripheral fat than you should, and that can interfere with signals coming from the brain to the ovary, and that can make your ovulation irregular and make it harder to get pregnant. Also, with excess weight comes insulin resistance, and this drives up the insulin that your pancreas produces, and insulin can act like a growth factor on the ovaries and cause the ovaries to produce more testosterone than what is considered healthy and normal and in balance. And these testosterone levels can also interfere with those signals from the pituitary gland to the ovaries, leading to increasing menstrual disturbances. In these types of circumstances, we know that losing weight can help restore the normal hormonal balance and therefore help to make someone more fertile because they're able to ovulate more regularly. Insulin resistance is also just bad for your health in general. So by correcting that, you're improving your overall health and your overall fertility. Now, some of these weight loss injections like Mounjaro or Zepbound have an active ingredient called tirzepatide, which is known to cause delayed gastric emptying. And there is even a warning on the label that this drug can interfere with the absorption of oral contraceptives, making them less efficacious. So you're supposed to, if you're taking Mounjaro or Zepbound, use a secondary form of contraception as a backup, like condoms. Semaglutides like Ozempic and Wegovy don't have as profound an effect on gastric emptying, and that's why their drug labels do not have this warning about oral contraceptives being less effective. Two things I want to add from my perspective as a fertility specialist are, one, that I think the large majority of these reports online of women getting pregnant after taking Ozempic or drugs like Ozempic are because of the positive impact that weight loss can have on reducing insulin resistance and restoring normal hormonal balance and ovarian function, allowing people to ovulate more regularly and reduce insulin resistance that restores a more normal environment that's conducive to the development of a pregnancy. I think in the vast majority of cases, it was this versus someone's birth control not being as effective. But I do think it's important, especially if you're taking those two drugs I mentioned earlier, to have a secondary backup plan, because there is theoretically that risk of birth control being less effective if you're on those medications. Secondly, I think it's important to remind everyone that you're supposed to be off of these drugs if you're pregnant. So if you're not actively trying to avoid pregnancy, this is something to be aware of, because there's a lack of human safety data on taking these medications while pregnant. And there is some animal data that is suggesting that there could be a risk of fetal growth restriction and certain developmental anomalies if there is exposure in utero to these types of medications. So that's something to just be aware of and be very careful.